How can you manage LDL and HDL cholesterol for stroke prevention? Managing your cholesterol levels is a key step in reducing your risk of stroke, especially ischemic stroke caused by artery blockages. Let's explore how you can keep your LDL and HDL cholesterol in check to protect your brain health. LDL cholesterol, often called the bad cholesterol, can build up in your arteries over time, forming plaques that narrow blood vessels and increase stroke risk. On the other hand, HDL cholesterol is known as the good cholesterol because it helps remove excess LDL from your bloodstream, acting like a cleanup crew for your arteries. For stroke prevention, health guidelines recommend keeping your LDL cholesterol below 70 milligrams per deciliter, especially if you've already had a stroke or transient ischemic attack. Higher HDL levels, ideally at least 35 milligrams per deciliter, are associated with a lower risk of ischemic stroke, especially those caused by atherosclerosis. Making lifestyle changes is the foundation of managing cholesterol. Adopting a heart-healthy diet like the Mediterranean diet can make a big difference. This diet emphasizes fruits, vegetables, whole grains, nuts, legumes, olive oil, and lean proteins such as fish. It helps lower LDL cholesterol and can boost HDL levels. Reducing intake of saturated fats and trans fats found in red meat, full-fat dairy, and processed foods is also important. Increasing fiber-rich foods like oats, beans, and fruits can help lower LDL cholesterol. Limiting salt intake supports blood pressure control, which is another stroke risk factor. Regular aerobic exercise, such as brisk walking or cycling, can raise HDL and lower LDL. Avoid smoking because it lowers HDL and damages blood vessels, and limit alcohol intake, as excessive drinking can harm your cholesterol balance. When lifestyle changes aren't enough, medications can help. Statins are the most common drugs used to lower LDL cholesterol. They have been shown to reduce stroke risk significantly, with some studies indicating about a 21% reduction in recurrent strokes for every 1 millimole per liter decrease in LDL. For those who cannot tolerate statins or need additional lowering, newer options like PCSK9 inhibitors or cholesterol absorption inhibitors may be considered. It's important to work closely with your healthcare provider to personalize your treatment plan, combining medication with lifestyle habits for the best results. Monitoring your cholesterol levels regularly is essential. Blood tests can help your doctor see how well your strategies are working and whether adjustments are needed. Remember, individual risk factors like age, blood pressure, diabetes, and previous strokes all influence your management plan. While lowering LDL cholesterol is beneficial, some studies suggest that very low levels might slightly increase the risk of bleeding in the brain, so your healthcare provider will balance these factors carefully. In summary, managing LDL and HDL cholesterol for stroke prevention involves eating a nutritious, balanced diet, staying physically active, avoiding smoking, limiting alcohol, and taking medications if necessary. These steps help prevent plaque buildup in your arteries, reducing the chance of blockages that can cause a stroke. Always consult your healthcare professional for personalized advice, as they can help tailor a plan that fits your specific health needs. Regular checkups and blood tests are your best tools to stay on track and protect your brain health over time.